am Mike.
And I am Adrian.
And we are young doctors from the Philippines.
If this is your first time to join us, we talk about anything related to pre-med, med proper, clerkship, internship, PLE, USMLE, and beyond.
Welcome to the Better Pill, your weekly prescription of tips and insights to become better students,
better interns,
and better doctors.
What's up, better doctors? Kamusta po kayo? Bro, kamusta ka?
Bro, kamusta rin bro? Mukhang napapadalas ang workout mo ah.
Hindi naman, sakto lang.
Siguro bro, yung kaka-workout mo, marami kang muscle na ginagamit, no? Na-memorize mo ba yung mga muscle na ginagamit mo? Kada workout, na-memorize mo ba ano yung origin niya, insertion niya?
Siyempre bro, nung undergrad, memorize talaga namin yan. Well, anyways, our topic for today, I think, is another very important topic, especially for the first years, the freshmen, bro, no?
Tama.
Kasi, isa to sa mga, kung last time we talked about the most dreaded subject in second year, today we're gonna be talking about siguro the most dreaded subject in first year.
Kabilang ako dyan, bro, sa mga nanginginig habang narinig yung salitang anatomy and practical exam.
Well, actually, anatomy kasi it's a very important subject din. And that's why it's taught in the first year. Because not only is it useful for the clinical subjects and even clinical practice, lalo na surgery, no? But not only surgery.
Tama bro, napaka-importante ng anatomy. Kahit hanggang clerk or resident ka na or consultant, diba? Pag nag-o-opera ka, kailangan ma-identify mo yung mga important vessels, important nerves para sa pasyente. Hindi ka magkaroon ng mga complications or accidents, diba?
Totoo, agree ako. And in first year, feeling ko tandem din to with physiology kasi if anatomy is form, physiology is function. So, that's why nga feeling ko, they're taught in the first year, both of them, kasi pair din talaga sila.
Parang bro, complementary silang dalawa, no?
Yes, agree. Well, anyway, ang flow natin for today, bro, is, bro and I decided to divide this topic into 2 episodes, no? So, our first part, there will be 2 parts. First parts will be discussing specific tips on how to approach anatomy. No? And our part 2 naman, which will be the next episode,
yung Q&A natin,
naman. Yes. We compiled some questions, frequently asked questions, and then we're gonna tackle each question in part 2 of this episode.
Sa mga first time pala makinig, si Adrian pala, as mentioned sa episode number 2, siya ay isang physical therapist po. So, meron siyang strong background sa anatomy. Unlike me na BS Pharma. So, makikita nyo yung perspective ng expert and yung mga noob pagdating sa first year sa medicine.
Hindi naman expert, no? But, bro, siguro yung point of view mo rin dito is very important kasi a lot of our first years also do not have a very strong background in anatomy.
Mostly naman bro diba sa classroom natin, ilan ba kayong PT boy?
Sa classroom, 2 lang PT.
2 lang, no?
Out of 120. More or less. Well, anyway, let's get right into the topic. No? Let's go to the specific tips on how to approach gross anatomy in medical school. Specific to how we're talking about anatomy, how to study anatomy in medical school.
Ano ba bro yung first tip mo for studying anatomy?
First tip? Well, lagi naman ito yung first tip natin. If we can encapsulate this whole episode into...
Ito ba yung favorite word natin?
Ito yung favorite tip talaga natin. We're talking about mindset. Okay, first tip. Tip number 1 on how to study anatomy. You have to have the right mindset. Bakit ba bro? Why do we have to have the right mindset?
Tama naman bro sa case ko, kunyari, Dahil wala naman akong background sa anatomy, yung mindset ko noon, parang loser's mindset. Kumbaga, may PT boy, ikaw. So, parang racing, parang nauna ka na sa racing. So, wala na akong balak habulin ka. So, parang nasa unahan kita, ako nasa likod lang. So, simula pa lang nung anatomy, ganun na. So,
So,
sunod-sunod na yan.
kumbaga bro, hindi mo pa nabuklat yung Snell mo, hindi ka pa nakapag first quiz, feeling mo, hindi mo na siya kaya. Feeling mo sobrang hirap na niya. Ganun ba yung mindset mo dati?
Parang na-brainwash kami bro na ako, na sobrang hirap niya, especially yung dissection, yung practical exam. Masyadong overestimate yung hardness niya.
Okay, gets. Kasi ganun din naman yung feeling ko for pharmacology.
So, yun talaga, first step pa lang, no? Sana na-advisean ako na right mindset, no? Para
Agree.
hindi na,
Kasi, well, anatomy, we can't deny naman that it's a hard subject, bro. Pero kaya talaga siya. Especially if you apply the right study tips, the right strategies on how to approach it, which we will discuss naman in the next tips. Pero, first thing talaga, and foremost is, you really have to have the right mindset. Kasi pag yung mindset mo mali, pag pinangunahan ka na ng kaba mo, mahihirapan ka na. Hirapan kang i-tackle yung specific topics. At feeling mo, sa isip mo, sobrang hirap niya. So, alam mo yun, hindi mo siya maaaral ng maayos.
Actually bro, nung first quiz pa lang, alam ko na babagsak ako eh. Yung ganun agad yung mindset ko eh.
Grabe. yun na yung mindset mo. So, sobrang severe na...
So, OA naman, OA.
Oo, sobrang OA ng mindset mo. Pero, that happens talaga, di ba? Nangyari naman talaga yun. So, we have to,
To address that.
advise our listeners na always, hindi lang naman to for anatomy, bro, no? The right mindset. To always have the right mindset when approaching anything, hindi lang anatomy. That's number 1. Let's move on to number 2, bro. My number 2 tip, no, na how to study anatomy, which is also very important na feeling ko hindi rin masyadong na-appreciate ng karamihan. It's to always study with pictures, okay? And not only the pictures that come with your textbook. Kasi di ba bro, sa textbook natin, for example, in our med school, we use Snell. May mga pictures na sa Snell, di ba?
Tama bro. Actually ako bro, sa case ko, sabi kasi diba, only dapat Snell-based lang, no? So, hindi na ako nag-bother na mag-search sa Google kasi feeling ko mamamali yung nasa utak ko eh. Pag outside Snell. So, yun siguro bro. Kasi minsan diba, kulang-kulang din yung, hindi naman sa kulang. Isang perspective lang yung picture sa Snell.
And no bro, tama naman sinabi mo, medyo kulang din talaga siya. Anatomy kasi bro, diba it's a very visual subject. Talagang it's all about form, it's all about body parts, it's all about relationships.
Relationships,
No? So,
tama.
Yes. Ibang relationships bro. So, it's very visual. So that you really have to study with pictures. As in, I'm talking about an atlas or kahit you Google pictures. Okay? For me, it's wrong to just study the text, bro. Minsan kasi nag-aaral tayo for a quiz. Kasi syempre, yung most of our exams wala namang pictures, bro, di ba? Wala namang pictures. So, feeling natin, dahil text lang naman yung, words lang naman yung exam natin, feeling natin, okay, it's enough to study just the text.
Tama bro. Actually, yung mga inaaral natin, yung mga sinasabi lang nung professor, yung nasa textbook, minsan hindi tayo nag-bother na tumingin sa mga pictures, kahit man lang sa textbook.
So yun, no? Study with an atlas beside the text. Or kahit Google lang.
Actually
just
bro,
Google the pictures
kahit mag-aaral ka ng picture, parang small portion ng oras lang eh, no? Parang saglit lang. Parang 90% text. Pag may sobra ka pang oras, yung picture na. Parang di siya binibigyan ng ganong importance.
Which is wrong. Yun yung strategy mo before.
Yeah,
More on sa
yes,
text
bro.
ka nagfo-focus.
Yes, bro.
Which is wrong. So, ang ginagawa ko nga dati is first, before a topic, inaaral ko muna yung pictures before I go into the text. Hindi naman sobrang memorize. Titingnan ko lang para may overview ako. Para may bird's eye view. Favorite word mo yan bird's eye view. And then after looking into the pictures, I go to the text na. But while you're reading the text, bro, kailangan side by side with picture. Habang binabasa mo yung description ng body parts, tinitingnan mo rin yung picture.
Dapat
Google
match,
mo,
no?
tingnan mo sa atlas.
Kung hindi maganda yung picture, maghanap ka ng picture siguro,
Hanap ka
no?
ng iba. Na maintindihan mo talaga yung binabasa mo. Hindi lang memorize, maintindihan mo talaga yung binabasa mo. Yun, kasi it's really not enough to just study the text. Dapat may pictures talaga. In fact, in my case, I learn better with kahit the pictures lang compared to text lang.
Text.
And analogy ko kasi yan, just want to give an analogy, no? Ang analogy ko then, bro, if reading the text only, it's like going into a cave without a torch or a lamp. Papasok ka, wala kang ilaw. Wala kang guide. Ganon. Mawawala ka talaga sa loob. But if you have a lamp, you have a torch, you have a picture, you have a map right beside you, it's easier to navigate through the cave.
Actually, bro, yung maganda nga yung tip mo na study with pictures na with emphasis, no? Kasi ang goal natin is to prolong the retention. Kasi ang goal ko lang dati, mapasa yung quiz.
Mapasa lang. Yun
mapasa
yung goal
lang,
mo. Just to survive, no?
Just to survive.
Siyempre, bro, hindi naman yun yung goal natin dito sa Better Pill. No, it's really to become better doctors, better students, better interns, and better doctors.
For the patient, diba? Yun ang ultimate
for the
goal,
patient, no? Yeah. That's the ultimate
centered sa
purpose.
Patient.
Para sa patient naman talaga natin. It's not enough to just survive med school. We really want to lock in the information na hindi makalimutan, maintindihan talaga.
Diba bro, pag OR, no, napaka-importante ng anatomy, no? Pag localize, maiwasan yung important vessels, diba?
Yes, of course.
Kasi bro, kung magkamali tayo, ang sasabihin natin, one word lang Oops. Tapos pag umulit, I did it again.
Siyempre, hindi yun pwede, bro. Kaya, this is why we're doing this, right? So, tip number 1, bro, recap lang natin, no? Para hindi tayo wala. Tip number 1, you have to have the right mindset. And tip number 2 is you have to study with pictures. Let's go to tip number 3.
Nakadalawang X na ako, bro, sa America's Got Talent. So, right mindset and study with pictures.
So, yun. Okay? So, let's go to tip number 3. Ito din, this is also important, pero hindi naman to talaga super required. Pero importante din, it really helps. And I'm talking about mnemonics. Do you use mnemonics, bro?
Sa anatomy, bro, hindi ako makagamit masyado Hindi ko alam kung bakit Pero ikaw, bro, are you mnemonics heavy sa anatomy? Considering na PT graduate ka.
Actually, maraming useful and funny and marami din akong original mnemonics sa anatomy.
May example ka ba, bro? Ng classic?
Galing pang PT. Of course, example, yung carpal bones, diba? Yung some lovers try positions that they cannot handle. Talagang nakalock in na yan sa utak natin.
Ako naman, bro, sa ganyan, she looks too pretty. Oh, she looks so pretty ba? Too pretty, try to catch her. Yun lang, yun ang naalala ko.
Diba? So, naaalala talaga natin yung mnemonics. But again, bro, hindi pwedeng mnemonics lang. Kasi some of us, and also I'm guilty of that, no? Pag kinakapos ako sa oras, I use mnemonics to learn something. But you don't use mnemonics to learn something. You just use that to lock in information that you have learned already some other way. Mahirap kasi pag inaral mo yung something through mnemonics lang. Of
Dapat,
course,
bro,
we have
no? Understanding muna, no? Before mnemonics.
understand talaga muna. We really have to, yung sinabi natin before, study the text with pictures talaga muna. Study with pictures. Before we use mnemonics, yung mnemonics, we use that after studying the right way. Because it helps us lock in the information. Lalo na yung mga kailangan i-memorize. Because there are some information talaga, bro, that you really have to memorize. For example, yung mga layers ng muscles, may mga ganun eh. You really have to memorize them. So, for those parts, mnemonics are very helpful.
Okay, bro.
So, mnemonics are just used to reinforce your knowledge, not really to learn new information, which we are guilty of doing sometimes. So, that's our tip number 3. Tip number 1, right mindset. Tip number 2, study with pictures. And tip number 3 is to use mnemonics. Let's go to tip number 4 naman. This is also one of our favorite, no?
El favorito.
So tip number 4 is use Samplexes or previous exams or Q banks. Okay?
Siguro, bro, tama. Siguro use Samplex the right way, no?
Yes, the right way naman. Okay? There's a right way to do this, and let's do a separate episode for how to use Samplexes siguro, no?
Bro, sige bro, mahaba-habang ano yan.
Okay, but for the case of anatomy, it's very important to use Samplexes also. And in my opinion, bro, yung anatomy yung isa sa subject na maganda talagang gamitin yung Samplex. Bakit?
Feeling ko, bro, sa analogy ko, yung para kang yung pinupush ka na sa actual. Parang baby na hindi pa marunong mag-swimming. Tapos bigla mong nilagay sa pool. So, ma-force yung baby na matutong lumangoy.
Kumbaga,
Parang
parang sabak agad.
Sabak, parang on-the-job training ka na agad, di ba?
Yeah. Gets. Kasi, syempre, the exams will be how the Samplexes are. Ganun din naman eh. Multiple choice most of the time, no? But, in my opinion, Samplexes are useful in anatomy, bro. Specifically, no? Because, anatomy doesn't change naman eh. And,
tama, bro. Siguro, bro, it will change after 1 million years, no? Pag nag-evolve na yung katawan natin, na? Wala nang biceps, wala nang triceps.
Agree.
Hindi naman tayo ganun kahaba, bro.
And, may mga favorite talagang itanong yung professors, no? Lalo na yung mga important na, may mga landmarks. Important kasi na, landmarks, mga clinically relevant na mga topics and clinically relevant information. Lalo na yung mga yun. Our professors love asking those. And they love asking those because yun yung mga important na makakatulong sa atin and how to care for our patients talaga. Agree, bro?
Agree ako, bro. 100%. Pero, bro, tama naman, bro, no? Pag nag-Samplex ka, no? Iba yung feeling na sumasagot ka na prior to exam versus sa reading lang. Tama ba yun, bro, no?
Oo, of course. So, since we're talking about using Samplex the right way, bro, no? So, can you discuss a bit on what we mean by using Samplex the right way? Or sige, baliktarin natin. How do you use Samplex the wrong way?
Yan ang kaya kong sagutin, bro. Yeah. Sa case ko, bro. Binabasa ko lang yung Samplex. Tapos,
based on your experience.
Alam ko na yung sagot kasi may answer key. Pero ang problema, minsan yung answer key, poison.
So kumbaga, tinatanggap mo lang kaagad yung sagot.
Iniisip ko, bakit yun ang sagot kahit mali? And number 2, bro, pag blanco yung Samplex, hindi ko na sinasagutan. Hindi ko na binabother sagutan kasi hanapin ko pa yung sagot eh. Kaya minsan may mga Samplex na blank.
Feeling ko, bro, hindi mo masyadong na-value yung value ng Samplex before, no? Kasi,
Tama, bro.
isa yun sa value ng Samplex eh.
Kasi bro,
Isa yun
feeling
sa
ko,
mga benefits, yun, rationalizing it.
time-consuming pag hanapin mo pa yung sagot pag wala yung answer key.
Okay, gets. But did you realize, bro, na looking for the answer is actually one of the best ways to use Samplex and to lock in information? Okay, so number one wrong tip or number one way to use the Samplex incorrectly is to not rationalize. No? So you really have to rationalize Samplexes when using them. Okay, number 2 tip, bro. Ako naman, bigay akong tip na mali. Is using the Samplex only. Okay. Or studying with the Samplex only. May mga ganun, bro, di ba? Sometimes pag kinapos tayo sa oras.
Pag kinapos sa oras.
Samplex na lang, ganun.
Copy to Samplex.
That's so wrong. That's so wrong, no? On so many levels.
Pero minsan, bro, pag parang jackpot sa loto, kung napakaswerte mo, di ba?
But for the patient, bro.
For the patient.
Yun lang yung alam. For sa topic na yun lang yung alam mo, yung nasa Samplex. Hindi yun pwede for the patient. Our ultimate goal. Diba, bro? Patient care. So, hindi pwede yung Samplex only. Okay, so, not rationalizing, using the Samplex only. Third way on how to use the Samplex incorrectly, bro. It's thinking of the Samplex when answering the actual exam. Sometimes kasi the professors, they tweak, not sometimes, most of the time, they tweak questions. They change a word. They add except.
Yung
they add not true. Mga ganon. When you answer a Samplex and you just memorize the answers and you don't really rationalize, you don't analyze the questions, sasagot mo kaagad yung nasa Samplex. Most of the time, binabago nila yun eh. So, when you think of the Samplex when answering the actual exam,
in that case, yung Samplex naging kaaway mo na, no? Kasi you use it the wrong way.
And after using Samplexes the wrong way kasi, bro, mawawala yung value niya for you. Parang sasabihin mo, ayoko na mag-Samplex. Ilang beses na ako nagkamali sa exam dahil sa Samplex. Well, it's not really because of the Samplex. It's because of you. Because you used the Samplex the wrong way. So there's really actually utility in using Samplexes, especially if you use it the right way.
So yun, baka magtampo yung Samplex. Tsaka yung ikaw. Nagkatampuan kaya, no? Hindi na-appreciate.
Diba? So yun. So let's, again, review our tips.
So, yung Tip number 1, bro, yung sabi mo, right mindset. Number 2, study with pictures. Number 3, use mnemonics. Number 4, Samplex. And use it the right way. So, ano ba yung last tip mo, bro?
Okay, let's move on to the 5th and the last tip natin. No? My 5th and last tip is clinical correlation. Clinical correlation of anatomy. Why is this very important? For me, bro, this is very important because this gives meaning. Okay? It gives meaning to your knowledge in anatomy. It gives meaning to information which might seem insignificant or trivial. Okay? Pag hindi mo pa na-correlate clinically. Example.
Nagkakaroon ng kahulugan, no?
Nagkakaroon ng kahulugan. That's very important because it not only does it make you remember information more, bro, gives it meaning also. And mas maaalala mo siya at malalaki in talaga information sa utak mo pag may kahulugan. Ganun naman lagi hindi lang sa anatomy. Example, bro, yung walang kamatayang sternal angle of fluid.
Bro, kaya
naman yung dinidiscuss,
sa clerkship, bro, no? Sa internship, hinahanap-hanap yan si Louis, no?
Lagi talaga, oo.
Actually, so, bro, feeling ko ang yabang na ni Louis, no? Lagi siyang hinahanap. Kahit
Buti
consultant.
pa si Louie, bro,
Oo.
hinahanap.
Oo, grabe
Buti
si
pa siya,
Louie.
hinahanap.
Oo nga, no?
So, why is it important? Because it's a very important landmark, bro, for locating structures. Behind it, there are important structures also. It's a landmark in the mediastinum. It's also a landmark for looking for the intercostal spaces, which is very important din, bro, di ba? Okay, so another example. Can you give another example, bro,
Ako,
of
bro,
clinically relevant anatomy?
Ano, bro, yung anatomical snuff box.
Oh.
So, yun, di
Why
ba?
is this important?
Sa pagkakalala ko, bro, no, may bone dyan na prone sa fracture. And historically, bro, yung anatomical snuff box, doon yata nilalagay yung parang cocaine ba yan? Or ano? Para mas...
Kaya snuff.
Oo.
Kaya snuff box, no? Pero yun, hindi clinically relevant
ano.
yung part na yun. Pero, agree. Sinabi mo, there's a bone. Okay? Let's leave it to our first years na lang to
search
know
na
what
lang.
that is. Also, bro, yung borders ng snuff box, bro, may tendons dyan, di ba?
Mm-mm.
Yung borders niya are tendons or muscle of important muscles din of the wrist and forearm. So, aralin nyo na lang yan. Okay. We're not here to discuss the anatomy talaga. We're just here to discuss approaches on how to study anatomy. Another important example, bro. Sige, let's give another example. Yung intercostal neurovascular bundle, yung intercostal arteries, veins, and nerves in the costal groove, diba?
Very important, bro, no?
Inferior part of the rib, no? Nandun siya. So, very important din, bro. Bakit nga ba, bro? Bakit important to?
Diba, bro, pa nagpo-perform ka ng mga procedure na kailangan tumusok sa thorax, kailangan mo maiwasan yung mga vessels, no? And nerves.
Siyempre. Or else, ma-injure yun, bro, di ba?
Ano, bro, ulit yung sasabihin natin kapag nagkamali tayo?
Oops. Siyempre, iniiwasan natin yun. So, of course, you have to, tusok ka sa above the rib. Unless you have to give anesthesia siguro, bro. O kung i-anesthetize mo yung part na yun, so, doon, you hit the inferior. So, depende sa goal mo rin. Well, anyways, yun yung importance of correlating anatomy.
Tsaka, bro,
clinically.
yung mga procedure, bro, ma-appreciate mo bakit ang insertion mo, ay yung pagtusok mo, ganun. Parang, pag alam mo yung anatomy, ma-appreciate mo kung bakit kailangan kapain si sternal angle.
And here, bro, you will realize, no, that more than anything, medicine is really about understanding. Kasi, mali yung mindset natin na ang daming dapat i-memorize sa medicine. Ang daming dapat. Alam mo yun, di ba ganun yung, that's how our mind worked before in med school na daming dapat i-memorize.
Kailangan lahat i-memorize, no?
Oo, hindi naman ganun eh. Siguro, it's better to say na ang daming dapat intindihin or daming dapat i-understand. Which is, for me, more important talaga. Understanding over memorization.
Over memorization.
Yes. Agree. 100%.
If you understand, bro, yung memory, it will follow na lang, no?
Yes, bro. At saka, it's easier to memorize pag naintindihan mo. Agree ka ba dun?
Agree, bro.
Lagi natin yung sinasabi na understand talaga.
Actually, bro, natanong ko din sa'yo, bro, Sabi ko, Adrian, how do you study effectively? Yung anday mong minamemorize, tapos ang tataas ng score mo. Yun lagi sagot mo, Understanding muna before memorization.
Yes. Always yan. Not only for anatomy, for pharma, for across all subjects. Pag naintindihan mo talaga kasi, it's really easier to correlate with the other subjects. Correlated naman lahat sa medicine, bro, di ba?
Yes, bro.
And I think that's also one way of measuring how much you know if nako-correlate mo yung different subjects in medicine. Because that's the ultimate goal.
So bro, no, recap natin, no? So number 1, right mindset. So
Number 2,
yun. Study with
pictures.
Number 3, use mnemonics. But sabi mo nga, don't learn with mnemonics. So understanding muna before mnemonics.
Yes.
Number 4, use Samplex the right way. And number 5, give clinical correlation. Diba? Para ma-appreciate natin, no?
Yes. So, that actually ends the first part of this episode, no? We're just giving specific tips for the first part of this episode. But there will be a part 2. Okay? In the part 2,
Yung mga Q&A ko naman.
Yes, na-collect namin. And then, as somebody with a strong, di naman very strong, pero a strong background in anatomy.
Batak.
And and siguro as somebody who has studied anatomy longer than most
Grabe,
medical
no?
students.
5 years.
Kasi,
5 years
nung
mo
PT kami,
natin,
inaral
no?
din talaga namin yung anatomy. And feeling ko nga, bro, we studied it more in depth. Okay? Especially the neuromuscular system. Hindi naman, pag internal organs, ganon, hindi masyado. Pero yung mga muscles talaga, nerves, neuro, inaral talaga namin.
Kaya pala,
Medyo
ang galing mag-isolate ni Adrian, no? Pag sa workout, kayang i-isolate din lang. No? Gusto ko yung
Hindi.
Hindi
naman.
yung biceps. Gusto ko itong head lang yung papalakihin ko.
Short head lang.
Short head lang. Yung long head, ayokong palakihin. Sobrang galing mag-isolate.
Well, kidding aside, no? So, for part 2, we're gonna tackle the Q&A which we have collected. But I hope you learned a thing or two today in the first part of this episode. Kasi again, anatomy.
I learned a lot, bro.
It's a challenging topic, no? Pero kaya naman talaga siya if
kaya, bro, no?
you study the right way, diba?
Bro, in retrospect, kung alam ko lang tong mga tips, kahit dalawa lang dito or 3, feeling ko na ace ko sana yung anatomy.
Bakit hindi ka nagtanong nung first year?
Siguro na-shock tayong lahat, diba? Parang, ang heavy kasi ng mga subjects noon, no?
And hindi lang kasi anatomy
hindi lang anatomy.
Niisip mo. Syempre, no?
So, yun. Try ko ulit, bro, mag-search sa Lazada ng time machine kung meron na.
Nag-search ka ba recently? Wala pa
lang, bro, time lang, tsaka machine, hiwalay.
Wala pang time machine. Sige.
Wala pa.
Try ko search mamaya. Baka
Shopee
meron
naman,
ako.
Shopee.
Sige. Well, anyway, this has been Adrian.
And this has been Mike. Catch us again next week for your refill prescription of the Better Pill. Next ko na, bro. Stop.